Right, so we have just been describing cervical vertebra, and we said there are 7 in number. The first one, the second, and the 7th, we said they're atypical, and the rest of them are typical. Then I was now describing the connections between these bones rather, where we have joints. And I gave reference to atlanto-occipital joint, where we say there's the flexion and the extension. Then I also then said there is the atlantoaxial, where there's the rotation. Right. And I was saying those joints, basically, we're going to be having ligaments that are going to unite the bones together. For example, we said for atlantoaxial, there's going to be something called an apical ligament. There's also going to be something called an alar ligament. Right. We're also going to have what we call cruciate ligaments. And so we have cruciate ligaments. We have what we call membrana tectoria. But I wouldn't expect you guys to know all these things, but just know we have ligaments that are joining the bones together for the first 2 cervical vertebra. And in the case of the first joint between C1 and what do we call it? The occipital bone, rather, we have what we call atlanto-occipital membranes. So there is posterior, then there is anterior atlanto-occipital membranes. So these are membranes and ligaments existing between C1, C2, and the occipital bone. Beyond C2 now, being C3 all the way down the vertebral column, we start to talk about things that are joining the bones together. We have intervertebral discs in between there. Right. So we have intervertebral discs. We have joints between the bodies of vertebra. Remember, I showed you superior, inferior articular facets, for example. Those are going to be facets that allow for joints between 2 vertebral bodies. Right. Then I've told you about intervertebral disc. Intervertebral disc, structure-wise, not knowing if I can get a picture somewhere. Structure-wise, your intervertebral disc, it's going to have a nucleus pulposus at the center, then an annulus fibrosus around it. The nucleus pulposus has a propensity to herniate. So if it herniates and moves sideways, usually does it posterolateral. If it does that, it is going to compress on nearby structures, for example, spinal nerves. Right? That's a story for another day. So we have intervertebral discs, something that I didn't mention when we're doing the cervical region. Right? Then we will also be having ligaments. There is anterior, then there is posterior longitudinal ligaments. Longitudinal means they run longitudinal to the spine. Right? Then we also have other ligaments that are there. For example, supraspinous ligaments. That means they run from spine to spine. Some of these names are not really fancy. It seems fancy, but it means what it means. We have interspinous, joins 2 spines. Supraspinous, it's only unique that it joins the tips of the spines. Right. Then we have intertransversarium ligaments. They join transverse processes of vertebra. Right. Then we also have something called ligamentum flavum. Right. It connects lamina of adjacent vertebra. Then we talk about ligamentum nuchae. You guys are doing upper limb as well. Remember origin of a muscle called trapezius. Trapezius, you'd say it originates from superior nuchal lines, external occipital protuberance, then ligamentum nuchae. Then you say C7 to T12. The reason why you don't count C1 to C6 is because it's covered by something called a ligamentum nuchae. Right. So this is way in the cervical region. supraspinous and interspinous ligaments, they thicken. So the ligaments around the spines, they thicken to create something called a ligamentum nuchae that covers the spines of your cervical vertebra, C1 to C6, such that the first vertebra that I feel the spine at the back, it's C7, and it's called the vertebral prominence. Right. Anyways, I was trying to give something like more of a general outlook to things that I hadn't mentioned when we were doing cervical vertebra. Right. And then we also have what we call curves of the vertebral column. And we have what we call primary curvatures and secondary curvatures. So let's make sense of things. Primary curvatures you're born with. Secondary, they appear as you grow. Right. So think about a baby. What's the first thing that they do? They try to sit up upright and support the head. Next thing, they try to stand up. That means curvatures in the column for the cervical, where we are supporting the head, and the lumbar, where I'm standing up. Those are secondary. That means the curvatures in the thoracic and the sacral, I'm born with them. Those are what I call primary. So two you're born with, two they appear with development. Those that appear with development, one is for supporting the head when I sit upright, that's the cervical. Then the lumbar one is when I learn to stand upright. That's the reason why when a baby is trying to stand up, they don't just stand up. Sometimes you see them, they try to lean, they assume funny postures until they can fully stand when the curvature fully develops. Right? I just thought I could mention that. Right? So beyond the 7 cervical vertebra that we were describing previously in the previous session, we have 12 thoracic vertebra, right? So to make life easier again, you describe what's typical, then you describe what's atypical, right? And remember what I said, the last vertebra in a line resembles the next line. It also works vice versa. Some features of the first vertebra in a line will resemble the vertebra above it. For example, T1 features, some of the features of T1 will actually resemble the features of your cervical vertebra. Right. So, lazy people found a way to make life easy for themselves. Sorry, let's use this one. It's a beautiful picture. Within the thorax, there's a heart, right? So the body of a thoracic vertebra looks heart-shaped. Right? So there's a heart in the thorax. The body of a thoracic vertebra looks heart-shaped. There's a kidney in the lumbar region. The body of a lumbar vertebra looks kidney-shaped. Not knowing who was lazy enough to link those things to say, but yeah, makes life easy for you guys to remember. Right. Then, so in terms of body shape, there's a gradual change. The body from T1, it resembles those of the cervical vertebra. Then it changes to that of your thoracic vertebra, then starts to gradually change to that of the lumbar vertebra, such that the last thoracic vertebra will have a body that resembles the next line. Right? The same concept I was trying to describe. But just remember that the body in the thoracic region, it's heart-shaped. This is the vertebral foramen. Notice the difference there. For cervical region, I showed you a vertebral foramen that was large and it was triangular. This one looks small and it's oval in shape. Right? And I'm still going to apply the mnemonic pulp. Pedicle is anterior. Lamina is posterior. Right. So these are the pedicles. These are the lamina. Right. So where pedicle meets lamina, I still have a transverse process. But this time around, the transverse process does not have an opening within it. Only cervical vertebra have a foramen transversarium. Remember the point I was giving you in the previous lecture. So there is no opening within the transverse process of your thoracic vertebra. Then this is the spinous process. Where two lamina meet, I create a spinous process. Notice it's long, right? Versus that for a typical cervical vertebra, which was short and it was bifid. Okay. Vertebral foramen for thoracic region, it's small because the spinal cord it's thinnest in the thoracic region, right? Okay. So there is always a distinguishing feature for a vertebra. Something that is unique about it, which you don't find in any other vertebra. For example, cervical vertebra, I told you about the bifid spinous process. I also told you about the foramen transversarium. For this one, there is these facets on the side of the body. It won't make sense now without including the ribs in our discussion, but there are only 12 ribs and they're only there in the thoracic region. With, of course, an exception of people who have a cervical rib or a gorilla rib, which we call a lumbar rib. There are only 12 ribs. And when these ribs are present, they articulate with the vertebral column. So it's only on the bodies of thoracic vertebra where you see facets on the side. And these demifacets are for articulation with the ribs, right? Nothing else. Right. Then what else about them? This is the spinous process. This is a very good way to look at it. This one is not really, it's not really showing us what it really looks like. It's long, it's slender. Then you can see from this highlighted picture here that the spinous process of a thoracic vertebra, it's going to be long, then it's slender, and it's tapering as you go this way. I think you can see it's tapering going downwards. So it's directed downward. So it's long, slender, and it tapers downwards. Right. Then yes. Yes.
Sorry to take you a little bit back. You were talking about the joints, ne? And
Joints,
then,
yes.
yeah. I don't know how to pronounce it. The zygophosocelia something joint in the
Sorry?
zygo. Zygo. Oh my God.
It's zygophacial joint.
It's also part of types like it's also
Oh
under
yeah.
the occipital.
Oh, so for your zygophacial joints, these are now synovial joints in the spine.
Like everything, like the whole spine, not just only the cervical part.
Not only that,
I mean, like not only the cervical part, but you mean the whole spine.
yeah, basically the whole spine. So all the joints starting from C2, going all the way down to the sacrum. So these are
Oh,
joints
okay.
between vertebral arcs, where we talk about those superior and inferior articular facets. Each vertebra has superior articular facets, then inferior articular facets. So where those facets rather articulate with vertebra above and vertebra below, those are what we are referring to as physial joints, and they're synovial.
So you mean to tell me there are not discs there? It's just the I don't get it. Like,
okay, let me use this picture for you. Okay, the way it's oriented. Okay, it's fine. Let me draw something. Can you see the diagram I'm drawing?
oh yes, I can.
Okay, so there are going to be joints on the sides here where I'm putting the arrows between the facets. Between the facets, right? The facets are a bit outward. Then between the bodies in this region, where I'm going to put another color, maybe orange in this region, there's going to be an intervertebral disc, which on its own is going to form another joint.
Okay.
Right. So
This
what
one
we are
was
referring to as zygophysial or zygaphysia, whichever way you pronounce it, it's the ones that I've put in red.
okay.
But intervertebral disc, it's still going to be there between your vertebral bodies.
Okay. All right.
It makes sense now.
100%. Thank you.
Okay. Okay, need to reshare the screen. Okay. Okay. Then I think things to say that the upper facet looks bigger than the smaller facet. It will make sense when you do the ribs. With prerequisite knowledge of what the ribs do, how they articulate with your vertebral column, it's hard for you to just say the upper facet is larger, the smaller one is the inferior one. It has to do with the fact that the upper one will articulate with the rib at that level versus the lower one which articulates with the rib below. That one is going to be smaller. But you need to understand the ribs for that. So for now, let's just keep it simple, basic, and describe a thoracic vertebra. Right. Then also, I think it would be important to know the shape of superior articular facets. These ones, where they face, as well as the inferior ones. So the rule still applies. What you say for superior, it's going to be the opposite for inferior. Why? Because superior for, say, T5 will articulate with inferior for T4. So if they face the same directions, they are not going to form a complementary joint. So they have to be something like this, so they fit into each other. That's why they are facing different directions to have opposite shapes. Right. So anyone know the shape, the direction or the orientation of these facets?
Personally, I don't.
Okay. So I think you can look at the picture there. The superior ones are directed backward. Then you can see the spinous process is posterior. Then you can see that these facets are directed backward. Can you see that? They're directed backward and they're facing outward. That's lateral. So they're directed backward and lateral. Right. Then obviously for inferior, remember I said you change your words. So they are directed forwards and medial. So all you need is to remember one. Right. Then something that's unique about transverse processes for thoracic vertebrae is that they're club shaped. I think that's more for exams, something which we won't demonstrate with this kind of pictures. Right. Then we say they have a larger spine. Right. So which ones are atypical? thoracic vertebra? Which ones are going to be different? So it depends with books, but I'll say what I agree with. So T1, then T9 to T12. I know others will include T2, but I won't, not knowing what you guys are taught your side. So T1, then T9, T10, T11, T12. Those are what we call atypical. Atypical thoracic vertebra. So all you need is to know what makes it different. If you know what makes it different, that means everything else is the same. So you don't need to go back and read about everything else about it. Right? Anyone know why any of the vertebra are different? T1, T9, T10, T11, T12. Oh, we haven't done thorax, so it may not make sense for you guys. But anyway, a typical, yeah.
I think it has to do with the facets. Like some
Yes.
others don't have transverse, others have superior and inferior only, like that.
Okay, good. So a typical, yeah, that's the reason. A typical thoracic vertebra articulates with the ribs at 3 different sites. So far I've shown you 2. There are 2 sites on the body, the upper larger one and the smaller inferior one. Then there is another facet for the ribs, which is on the transverse process. This one articulates with the tubercle of the rib. I love to call this the TT joint, transverse process to tubercle of the rib. So those are the 3 sites. So you'd find that some of the vertebra, instead of having 2 facets on the body, they have 1. And they may also lack this facet on what do we call this? On the transverse process. Those are the main distinguishing features. For example, T9 has only 1 facet, the superior one. And T10 is the same. T11, T12 is the same. They only have 1 facet on the body. Another feature for T11 and T12 is that they don't have this facet on the transverse process. Then T1 resembles cervical vertebra and its spine. Remember, these spines for thoracic vertebrae, I say they're directed downward and they're long and they're slender. T1, instead of having that kind of that kind of spinous process, it has a spinous process that is horizontal. It's long, yes, but it's almost horizontal. It doesn't taper going downward like the rest of the thoracic vertebra. Right? Okay. Okay. Then the 3 joints that I said that exist between the vertebral column and the thoracic vertebra and the ribs rather, those are synovial joints. The joint between the head of the rib and the body on those 2 facets, as well as the joint between the tubercle of the rib and the transverse process on that transverse process facet, they're all synovial joints. Right. Okay. Any questions so far?
Nope. From me, no.
Okay.
I'm saying from me, no.
All right. What about the others? So no again.